Today is November the 14th. This is my Foley catheter critical. Before I enter my patient's room, I will review my physician's order. I'm not going to do it. Provide privacy. I'm going to perform hand hygiene. Good morning. How you doing today? My name is Sean. I'm going to be your student nurse. Can you please verify your name and date of birth? My patient verifies her name and date of birth, and I will check her armband and make sure that it matches. Okay, Ms. Jones, the doctor has ordered for you to get a Foley catheter because you've been retaining urine in your bladder, and it's going to help remove that excess urine. My patient verbalized she understands the procedure. I'm going to raise the bed to a working level.
I'll be the student nurse today. Could you please verify your name and your date of birth for me, please? Mrs. Jones, I'm going to check it against my patient's armband. It matches. Ms. Jones, this morning I'll be...
Okay, in order to insert a Foley catheter, my patient must be in a dorsal recumbent position.
The tube of the Foley will go inside of your bladder. The urine will drain out into this bag that will be kept on your bed frame. This bag needs to stay below your bed at all times, okay?
I'm going to raise my patient's legs. And before I start the procedure, I will ask my patient if she's allergic to iron down or bandage, and she states that she's not. I'm going to inspect her perineal area, and if I need to provide perineal care, I would, but at this time, I do not need to. So I'm going to remove my gloves. I'm going to get my Foley catheter kit. I'm going to inspect it, make sure that's not expired, and it's not. I'm going to make sure I have the appropriate size. I have a 14 French, so it can be used for a woman. I'm going to take this out the bag. I'm going to place this right here. Dispose of that. Okay, the supplies for the Foley catheter kit are sterile, so I want to maintain a sterile technique through the whole procedure. So I'm going to don me some sterile gloves. Alright, so stir to stir. I can touch everything inside this kit because I have sterile gloves. I don't need this, so I'm going to dispose of this. I'm going to take this field. I'm going to place the shiny side down. So I'm going to place that down. I don't need this as well, so I'm going to discard of that. I don't need the hydrogen peroxide, so I'll dispose of that. So take out my kit. I'm going to saturate my cotton balls with the bandage. So I will open this, saturate my cotton balls, dispose of that. I have my KY jersey. It's the lubricant to help the tip of the Foley catheter go in. So I'm going to take it, squirt it off inside of there, dispose of that. With this type of catheter, it says I need to insert 5 to 10 milliliters of normal saline or sterile water. So I have 10 milliliters of sterile water. I'm going to make sure because it doesn't have any bubbles. I'm going to remove this. Typically, I would connect the syringe to the Foley catheter, but because I have to do it differently with this type of catheter, I will put it on at the end. I'm going to take this down. I'm going to take the catheter out. And I'm going to remove the sleeve. Make sure I keep the tip sterile. Dispose of that. I'm going to take the tip of the catheter. I'm going to loop it up in the KY jelly. So my non-dominant hand, I'm going to place it and spread her labia. And I'm going to clean it from outer to inner. So I'm going to take one of my cotton balls.
Alright, Ms. Jones, this morning I'll be inserting a Foley catheter into you.
I'm going to take the catheter and I'm going to loop it up. Alright, Ms. Jones, you're going to feel a little bit of discomfort, but I need you to take a deep breath, and on the count of 3, I'm going to insert the tip of the catheter. On the count of 3, 1, 2, 3. And for a woman, I would insert the catheter 2 to 3 inches. I'm going to take my 10 milliliters of sterile water. And when I insert the catheter, urine should flash back out, and I would assess the color. And it should be a straw color, and it should be clear. I would give the balloon a tug to make sure that's secure, and it is. I'm going to dispose of my sterile gloves before hand hygiene. I want some disposable gloves.
Before I get started, I will check to see if my patient needs perineal care. My patient does not require any.
I'm going to get me some tape because you want to secure the leg band. I want to secure it to her inner thigh. And I'm going to leave some slack and square. So I'm going to take it. And secure it. I'm going to gather all my supplies and move it. And I'll ask to make sure my patient is comfortable. She thinks that she is. With the drainage bag, I'm going to place it on a non-movable part of the bed frame. Take it. I'm going to place it on a... Okay. I'm going to dispose of my supplies. I'm going to put my patient in a comfortable position. I'm going to educate my patient to make sure that she keeps the drainage bag below her bladder, and I will make sure that she has the call bell in reach so she can notify if any burning, pain, bleeding of her catheter comes out. I make sure the bed is in low position, the side rails up. I will document the catheter size, the color of the urine, and I will also initiate INO output, dispose of my gloves, perform hand hygiene, and that completes my Foley catheter.